We're talking to three of the Valley's key legislative leaders in Sacramento, Assemblymember Parra, Assemblymember Mike Villines, Assemblymember Juan Arambula, about what's happening in Sacramento. One of the big issues this year was health care. Roughly 6.7 million Californians were without health care last year, and the governor talked about 2007 being the year of health care reform. So, Assemblymember Arambula, where are we on comprehensive health care reform? What are the critical issues that remain?
Gee, I wish you could ask me this next week. We are scheduled to be in Sacramento next week to possibly vote on health care reforms. I was told Wednesday and Thursday. Mike just informed me that it could be as early as Tuesday of next week. We're all hoping that a compromise can be reached that we will be able to vote on, and hopefully we'll be able to know in time for the voters to receive their sample ballots and be able to get enough information so that they can cast an intelligent ballot.
You know, Senator Villines, the Republicans in the legislature seem to disagree with the Republican governor on this issue. What are the key issues that your Republican colleagues are concerned about in the legislature?
Well, we just fundamentally are opposed to taxes and tax increases. We think in a budget that's roughly $150 billion in California or $100 billion in general fund, there's a better way to prioritize those funds. So, and I think that Californians are looking at us to be responsible with our money. They're not asking us to say, okay, you've used all of the money, now please come put taxes on our back. It's a fundamental issue for us. So we've spent a year trying to get the governor to come to terms with what we'd like to do, which is incremental gain. You know, taking slower steps, but that you can ultimately get to a better solution. He doesn't agree with that, so he'll go forward with a much more bold plan, but that bold plan has pitfalls. It's asking Californians to support 4 taxes on the ballot, and I don't think that's a good way to do policy. The three of us are all policy people. I think it's better to take smaller steps and achieve things. So I know we have to answer quick, but you can take care of 650,000 people in California that are pre-existing, that truly can't get insurance as a first step. And then we can keep taking bites at the apple, help people, change the markets, and I think overall it'll be much better than creating this government-run socialized system.
Well, let me ask Assemblymember Parra. The Valley has a particularly acute health care coverage problem, high poverty rates, unemployment rates, et cetera. Which proposal of the ones being discussed do you think best fits the Valley needs?
None of them.
Okay.
Yeah. One of my big issues with all of the proposals is I am a strong supporter and I'm a true believer of health access. It's about, you know, getting healthcare clinics, getting people, you know, we can give everyone a healthcare card. I can enroll every child in healthy families. But if we don't have the physicians to see them, if we don't have the folks willing to see folks on Medi-Cal or even our Medicare system, you know, where are people going to go? I mean, even people with insurance. You know, I had a small medical issue and I was told, you know, wait 2 weeks and maybe they'll call you back for an appointment. So we're being impacted by, first of all, folks who need to see a doctor on an emergency basis, they can go see someone. But it's a matter of those who have insurance and those who are out in the rural communities to have that access to health care. So to be honest with you, I don't see much money for the supply of physicians. I don't see much money for getting physicians to come to the Central Valley, keeping physicians. We need specialists. If I was hit on 198, I would have to be medevac 2 hours away to see a specialist. If I had a very serious and critical condition, I'd probably die on my way to get service. So.
Well, it's coming down to money, though. Let me kind of transition a little bit here because I want to cover the state budget. I think that's very important. We have $145 billion, state budget.
We'll take the $45 million.
Yeah, don't we wish? In August, we were told we were going to have a $4.1 billion reserve. Now we're being told that it's going to be a $1.9 billion deficit this year, and then next year we could be $10 billion in the hole. So, Senator Parra, how did we get into this mess?
Well, 5 years ago when I was elected, we had a $26 billion deficit under Gray Davis. Then we threw Gray Davis out and we have Governor Schwarzenegger. The problem with, and I'll be very brief here, is we have a term-limited legislative body. We have folks who represent very partisan districts, either very safe Democrat or very safe Republican districts. So you throw that together, and so you have new people involved. You don't have that long-term memory. You don't have people with the political will to make those tough decisions. We made a good decision when I was first elected to get Fabian Nunez in for 4 years. The Republicans got Kevin McCarthy. So for 4 years we had some stability. We have the best Big Five. We have Mike Villines in the room representing the Valley. We have Fabian and Parada and the governor and Ackerman. We have a good Big Five who've been through the budget. That's experience, that's relationships. we have a term limits initiative. If it fails, we'll have a new leadership team negotiating one of the worst budgets. So for me, how do we get into this mess? It's almost the institution is breeding this incompatibility to make those tough decisions on long-term issues.
Well, I'm going to have to ask, we've only got a minute left in this segment, unfortunately. Very quickly, some of them are Villines. Republicans don't want to see tax increases. And Dick Ackerman, Senate Minority Leader, your counterpart in the Senate, says Republicans won't support any tax increases. Okay, so what programs are going to have to be cut, and how much is that going to save?
Well, there's a couple things you have to do. You have to, first of all, you have to acknowledge the mess that we're in, right? We have to say that we're in a crisis, which means you reopen the budget that we just passed. And you have to put everything on the table. There can be no sacred cows for Republicans or for Democrats in terms of services and potential cuts. And you have to really try to find out who do we want to minimize cuts on and then look at everything.
But are taxes a sacred cow?
Taxes have to be a sacred cow for us. I mean, we're just not going to go up on them.
Well,
but again, I go back to this, $150 billion. If that's not enough money to do what we do in California, then there's a fundamental underlying mistake. You can't go to raising taxes to try to fix the problems. You have to make structural change, reform. That's what the three of us would be more interested in.
I want to get Senator Arambula in here for the last few seconds that we have remaining. How do you think we should deal with this budget deficit?
I think there will be some very painful cuts. The Republicans have said they will not support tax increases. We need their support to pass a budget. So we're going to have to look to tighten our belts everywhere we can. We need to make sure that we select our priorities carefully, because there will be some areas that will need to be cut even more than others. That's part of our job, to establish priorities and to try to live within our means.
Well, thank you very much, all of you, for being here. When we come back, we'll talk with veteran observers of state politics, David Schechter and Don Jackson, about the year that was and the year that's going to be in 2008. This is the Maddy Report.